markets right now because we have this breaking news. A 12th case now of the coronavirus here in the U.S. has just been confirmed in Wisconsin. The state's health agency has just released that news at the very same time as the Centers for Disease Control holds a press conference in Fairfield, California. You're looking at a live picture of that. And Fairfield is where two flights arrived earlier today, packed with hundreds of people, Americans who were stuck in Wuhan as the outbreak worsened. The people who are on these planes are expected to be forced to spend 14 days in quarantine at military bases here in the U.S. The virus continues to have a major impact on businesses around the globe. iPhone maker Foxconn says it will gradually reopen factories next week. But of course, it is one of the suppliers, certainly, and one of the manufacturers for Apple, which is showing green on the screen. While Michael Kors' parent company, Capri Holdings, and shoemaker Adidas say they are having to close up shop. And so is Nike, by the way. Access Health International President Dr. William Haseltine returned from Wuhan recently, where he chaired the U.S.-China Health Summit. Okay, you've got to tell me what you're hearing is happening on the ground.
Well, it's very disturbing for the people that live there, both in terms of their fear of the virus and also some of the public health responses. People are lining up outside of hospitals and sometimes waiting for hours to be seen in the middle of large crowds of people. So the responses there are difficult for the people who live there.
I saw a headline that said the Chinese leadership is sacrificing an entire province to avoid the spread. More than 60 million people in the Hubei province are still on lockdown. That can't be a good thing.
No, it's very uncomfortable for people.
Very, very difficult. But
Right.
We already know it's out. We have a 12th case breaking just right now. Is the United States, and I'm going to point blank ask you this, doctor, is the United States adequately prepared to deal with this virus?
We're not. We could have been, but we're not.
Why are we not?
We didn't take the first two warnings seriously enough. Both the SARS virus warning in 2003 and the 2012-2013 MERS outbreak. That's a warning that nature is sending us. Get prepared for something else. If it happens twice, now it's happened 3 times. My hope is that we take this seriously this time.
The CDC greenlit today nationwide distribution of its CDC test kits, which are really only supposed to be used for public health, I guess, labs.
Right.
But now they're saying, okay, we'll share them with hospitals around the nation. Today they announced this. This thing has been going on for 2 weeks. Well,
I think the serious impact for the United States is only recently appreciated. We could have anticipated this. This whole family of viruses is like a cold virus. It spreads just like a cold virus. Nothing new, except this is a cold variant of a cold virus with a very bad habit that people who are compromised in their lung function can die.
As a business network, we always look at the markets and try and find reasons that we see things like rallies or big sell-offs. Right now, we're very close to highs of the session, up 476 points. A piece of that rocket fuel that has certainly given lift to this market today was this belief that there is a vaccine or an actual cure out there. The World Health Organization promptly came out and said, no, human tests are months away.
That is correct. The announcement is somewhere between premature and irresponsible.
But you've got this race for vaccine makers, and they're all selling off, at least Gilead, Inovio, BioCryst, Moderna. And maybe it's because the belief is that they have not found the solution yet.
I think it's possible to find a vaccine. My preferred route would be to find a drug which prevents you from getting sick once you're exposed. This is a seasonal event, just like the flu. And a vaccine for this year's event won't necessarily protect next year's event. But a drug that prevents you from getting sick once you're exposed is possible, and I think is the correct solution.
If you were Health Secretary Alex Azar, what is the first thing you would be doing right now?
U.S. has authorities, mostly created over preparedness for bioterrorism, to fund and allow rapid approval of certain classes of diseases. And I think the first thing I would do if I were the Secretary of Health was to declare coronavirus to be on the list of those agents that are already covered by all the enabling legislation to allow investment and rapid approval. I created the first preparedness drug for anthrax. It took me 2 years from the idea the time the FDA approved it. We have those authorities.
long.
We should use it. It's too long for this one, but there will be another one.
We had Dr. Ken Alabek, who, of course, had defected
right.
from the Soviet Union, and he had created, before he was here in the U.S. to help our military and our
Exactly.
government, he had created the most virulent strain of anthrax, and he said this will get worse in the U.S. before it gets better. Do you agree?
I agree with that.
How much worse?
That neither Ken nor I can tell you.
We don't want to blow this out of proportion, then. It is 12 cases here in the U.S.
Right, and just to put it into proportion, 12 to 50,000 people in the U.S. die a year of the flu. The flu is something we know and we accept. We are geared to look at differences more than we are to existing dangers. And this is something new, and our brain triggers something new, something dangerous. That doesn't mean it's all, I favor preparedness over panic.
Doctor, thank you very much. We're glad you're back safely. Dr. William Haseltine.
Thank you.